Again, I want to take the opportunity to thank our healthcare workers, our firefighters, our EMS personnel, hospital staff, the administrators, everyone that's out on the front line, and all essential employees that are out on the front line every day, continuing service to keep the county running, but to the men and women that are protecting the county and on the front line to this epidemic. But I also want to remind your viewers and listeners, it was alarming. Governor Cuomo shut down the state to 75%, then to 100% of non-essential employees. And I have to tell you, driving around the county, I didn't notice a difference. I couldn't even get out on Central Avenue from a side street because there was so much traffic. There's people on the streets. There's people driving all over. People, world's changed. And the only way we're going to stop this spread is by staying home and using the new steps that we put out through the CDC, through the health departments, through the governor's office, and 6 feet of separation. Coughing into your arm, washing your hands. And that's not going to change if people continue to go on out like there's nothing going on. It's alarming. And we brought it up to the governor's office this morning. And I don't know what the next step's going to be, and we'll find out. But something has to change because people aren't waking up. The other thing is that we've had a lot of inquiries from citizens in the county wanting to see a map of where all the people live in our county that have COVID-19. It's not going to happen. It goes from the Department of Health out to the EOC and the Sheriff's Department. The EMS and responders know, but assume it's all over the county. And that's what we've been trying to tell you since day one, since we've been doing these press conferences. Assume it's everywhere. What are you gonna look at a map and you feel, oh, I'll stay out of that part of the county because I'm good over here? It doesn't work that way. We're not hiding anything. Stay home, slow this up. The more we stay home and isolate in place, we can slow this down. And that's what we're trying to do. We're trying to slow it down so we don't overcrowd our hospitals. We don't overcrowd our EMS personnel and our firefighters and police and officers that are on the street. We're trying to slow it down. And the only way we can do that is if you take this for real. And I gotta say, most people here in the county are. Most people are sitting back going, yes, the world's changed. But there's still a good portion of people out here that don't think the world changed. And please, like I said a couple days ago, put 3 names in your pocket of people that you love. And if you don't love anyone other than yourself, put your name in your pocket. Protect them people. And by doing this and staying home for a couple days is going to make a difference in someone else's life. So as of today, there's 136 cases. Yesterday when we talked, we had 122 cases, so we're up to 136 confirmed positive cases of COVID-19 in Albany County, with 576 people under mandatory quarantine, 652 individuals under precaution quarantine. We have 7 have been hospitalized, putting our hospitalization rate at about 5.1%, which is very low. And if you look at the number of tests that were taken in Albany County, it was over 2,700. And our positive test rate is under 5%, which is good. That means most people are paying attention and staying away from other people or keeping that social distance, and that's what we want. And like I said, with proper hygiene, cleaning your hands and everything else, it's gonna knock it down. This is very serious. And those at high risk, 7 people that are hospitalized, include 3 men, 4 women, between the ages of 52 and 90. 3 people are in ICU. And again, the only way we're going to slow this down and change is by stop going out and stay home in place for a couple days and take this serious. I want to again thank the not just the school districts, Gillen superintendent and school districts that have stepped up, the businesses. I met with Gillen superintendent yesterday, and they were, I want to say a big thank you to them. They actually gave us a bunch of PPE that will go out to employees at the Department of Health and out through the EOC, through the Sheriff's Department, which the Sheriff will put out. again, just it's making a difference, and that's what matters right now, is making a difference. And that's why I said I love about being county executive of this county. Companies and residents are stepping up, coming up with innovative ideas while they're home to help out the workers that are on the front line. So I can't thank you enough for that, and thank you, thank you, thank you, thank you. So the only good thing about the snow is it's going to keep kids off the playground sets now. We did put that request up to close all playground equipment, and I think Dr. Whalen said it perfectly. You know, it's all contaminated, so we have to stay off of that, but thank goodness with the snow. Again, I want to encourage people, you know, listen, it's a new norm, it's different, and if you have any anxiety and you just want to talk to somebody, don't forget our number, 518-269-6634. 518-269-6634, and they're open 7 days a week from 8 a.m. to 5. We've gotten over, 30-some calls already, and people are just, calling. And again, that's what it's there for. Someone to listen to you, someone to let you know everything's going to be all right, and, things are changing. The American Red Cross reached out to us. They still need blood. They still need supplies. Their blood, countless blood drives have been canceled, which will make it critical low, and they do need it. You can call by appointment only. You can call the American Red Cross. You want to donate, and that is essential. We do need to build up our blood banks. So you can call their number at 1-800-RED-CROSS, pretty easy, 1-800-RED-CROSS, or redcrossblood.org. and set up an appointment. And I do encourage people here in the Capital District to go out and to do that. I can't thank you enough. Again, we're reaching out to every resources we can. I can't thank Dr. Whalen, her leadership, and her team down at DOH, and to all the people that are volunteering. We're getting a lot of phone calls. They're calling to volunteer for the medical reserve, and it's appreciated. It really is. And we're going to be putting in people to work. So I can't thank you enough. And that's what it's all about. The Shaker Place, the cards have taken off. They're on the wall. The residents are loving them. So thank you for that. And it's actually cheering up the workers that are up there too, to see these cards and taking the time to show the residents what people are out there thinking about them. So it's really a morale builder for the workers just as much as the people that are up there. So thank you. I do want to remind everyone, today is the Great American Takeout Day for restaurants associations, so please continue to use them, keep them to work. It's helping, it's working. And again, I can't thank the people that are doing the social distancing and people that are taking this serious. People, wake up. It's here. It's all around us. You're not going to get a map up so we can make you feel safe going in certain parts of the county. It's all over. We need to roll up our sleeves. We need to work together. We need to be great residents, great neighbors. Come on. That's why we live in certain neighborhoods, because our neighbors. And we need to work together. And we'll get through this working together. I know I keep saying this. Take a step back, take a deep breath, evaluate the situation around you, and move forward. And just remember, what we do today will be judged tomorrow. And the way you act is going to be the way you're going to be judged 4 or 5 months down the road. And let's be the good Albany County residents that I know everyone's here. Let's be the great New Yorkers that we always step up to the plate when we're down at the most. And we're down right now. But we're going to come back. And I do want to commend the governor for his leadership. The governor's team that is in constant contact with us, NISAC, who's Steve Aquario and them been out there constantly having meetings and talking around the state what's going on, and County Executives America, which I'm president of, which we've been talking pretty much every time at noontime, and really just talking about how this is hitting other communities, not just here in New York State, but across this country, and how everyone's addressing this, because this is different for everybody. But again, I want to thank Dr. Whalen and turn it over to Dr. Whalen right now.
Thank you, County Executive McCoy. So as of today, we have 136 confirmed cases. If you look at the trajectory of cases over the past week, you see the progression and the evidence that COVID-19 is becoming more prevalent in the community. As we previously discussed, due to some limitations in widespread community testing, it's likely that we're not getting a true picture of what we are seeing in the community. And that's why we continue to urge caution to everyone in the community to continue to follow the advice laid out by County Executive McCoy, by Governor Cuomo, and by health officials across the state and across the country to stress the importance of social distancing, hand hygiene, and staying home. That curve that we keep talking about flattening is the essential piece of why social distancing is important. We continue to look to other countries who are in the midst of where we may be in a week or two. We know that their hospital systems are overwhelmed. We know that people are not getting the care that they would get in the normal course of events when you have a fully staffed hospital and full support needs such as ventilators and PPE that we would normally have. Flattening that curve gives us more time, gives us more resources. Without social distancing, we're looking at a large number of people being affected in a way that will overwhelm the system. With these strategies, we are looking at trying to make use of the resources that we have to continue to provide the excellent care that the residents in Albany County have come to expect from the excellent hospitals that we are served by. Please protect your hospitals. Please protect your healthcare workers. Please protect yourselves. Continue to do what we're asking you to do, and if you know others that aren't, please explain the importance to them. It's essential. We continue to follow all those that are under quarantine at the health department. We are sending out teams to visit in excess of 500 people at home on a daily basis. This is a tremendous stress to our workforce, but we are doing it. We are doing it because we know we need to play our part, and we know we need to ensure people are following the guidelines of their quarantine. Most people are. Most people get this. Most people understand that these recommendations that are being put in place that are so contrary to normal way of life for everybody are necessary. They are doing what we need to do to continue to respond to this in a manageable way. But we do need to look forward. We do need to look at where we could be a week from now, because that should inform what we are doing on a daily basis. Look to those other countries, like Italy. Look to the things that have happened there and realize that your everyday decisions are impacting how we are able to respond in a similar situation. The county executive continues to stress the gravity of this situation, and I echo that sentiment. This is essential. Please follow recommendations. Please stay home. Know the importance of protecting your family, your community, your healthcare system, so that we can get through all of this together. Thank you.